Governor Gina Raimondo says by this time next week, she wants the state to be able to test up to 800 people a day. Right now, the Department of Health's numbers show we are not even close to that.
And Steph Machado spoke to a man today who says his doctor wants him to be tested, but he's been unable to get one. She joins us now with his story and a response from state officials.
The Rhode Island Department of Health says they have the ability to test up to 200 patients a day. Their data shows an average of 56 people have been tested a day since March 1st. And some patients say they are getting the runaround as they try to find out if they have this virus.
That was pretty frustrating.
Mark McKay from Burrillville says he's been sick since Friday. A cough, fatigue, chest pressure. He had trouble breathing while working as a truck driver.
Called my boss, let him know what was going on. He met me out there with a bottle of disinfectant and asked me to just clean the truck, and then I went home.
McKay says his doctor told him to go to the hospital. He called ahead and went to Landmark Medical Center where they ruled out the flu or pneumonia.
They diagnosed me with a viral upper respiratory infection and suggested that I call the Department of Health and try and schedule an appointment for a COVID-19 test.
But he says the Department of Health just told him to call his doctor.
I'm starting to get kind of aggravated at this point. It's like, man, are you even listening to what I'm saying? I did call my doctor. My doctor told me to go to the hospital. I called the hospital. The hospital told me to go there, and both of them told me to call you. And now you're telling me to call my doctor.
Department of Health Director Dr. Nicole Alexander-Scott said Tuesday the state is working on giving medical providers the ability to directly order tests at their discretion.
We do not want it to be something that is held up by the Rhode Island Department of Health. We want to work in coordination with providers.
Until that testing is expanded, she says anyone with symptoms should act as if it is COVID-19 and stay home. McKay is doing that, but hopes he'll get a diagnosis.
At what point is it going to be safe for me to go hold my grandson again, or to go to work with coworkers and people that I see when I'm making deliveries?
Dr. Alexander-Scott says a person who has tested positive for COVID-19 can be considered negative if they've been fever-free for 3 days without medication and more than 7 days have passed since symptoms began. I'm Steph Machado, Eyewitness News.